And ready, 1, 2, 3.
Those are newly elected members of the House of Representatives, the class of the 119th Congress. Members of the current House and Senate, both Democrat and Republican, have been raising alarms about Trump's picks for some very sensitive posts. Donald Trump has nominated Robert F. Kennedy Jr. to lead his Department of Health and Human Services, an appointment that has alarmed many health officials. But what can he actually do in this position, and how could it affect us north of the border? For more on this, we're joined by Raywat Deonandan. He is an associate professor and epidemiologist at the University of Ottawa, and he joins us from Ottawa today. And Raywat, appreciate you taking the time. Thank you.
It's my pleasure. Thank you.
So what exactly is the Department of Health and Human Services, and how much control over public health in the United States would this give RFK Jr. if he gets this job?
Yeah, it's a presidential cabinet position overseeing, as you mentioned, HHS, which includes in its agencies the FDA, CDC, NIH. In general, what they do is they oversee and they regulate the food and medicines that Americans consume. They look at whether Medicare, Medicaid will pay for certain drugs and treatments. They fund to the tune of billions of dollars medical research. They handle the licensing of drugs. It's a lot. It's a pretty powerful position, and it really does affect almost all of American healthcare and health research.
Okay, almost all of American healthcare and health research. Let's also talk about the public health component of all this, because we know that that's a very important part of it. So RFK Jr. has famously spoken out against vaccines. What do you make of some of his controversial statements? And how risky could it be to have someone with his beliefs, correct me if I'm wrong, spreading falsehoods, not based on science, in a position like that?
He says a lot of problematic things. He has a lot of problematic views. He has some okay views, things that are quite defensible, but in large part, the anti-science contingent of his beliefs is troubling. The effect on the American population might be substantial. The effect on the Canadians might be a different story entirely. But, for example, he wants to defund all drug funding for the next 8 years. He wants to cut the vaccine distribution program that affects mostly low-income communities. He is doubtful of the effect of fluoride in water. He is skeptical of the role of viruses in causing HIV/AIDS. He is skeptical of the impact of infectious diseases in general. The question is, how much impact can one individual have in that position? It's an enormous ship, and ships don't turn on a dime. There is institutional memory. There is a large contingent of bureaucratic staffers who will probably resist many of the transformational and radical changes that he proposes. Keep in mind, too, that the Trump administration has yet to appoint leadership of the FDA, NIH, and CDC. They will certainly hold sway in any health-based policy making as well. So it's unclear the amount of impact he actually can have, whether negative or positive.
All right, it may be unclear in terms of his role in that at the top of that in an institutional setting, but he's going to be given a very public role where he's going to be able to spread falsehoods, anti-science messaging around something as important as vaccines and their effectiveness. No medical knowledge of any of this, no kind of medical background. I mean, is this not something that could really put lives at risk?
Dr. David Gorski calls his appointment an extinction-level threat to public health in general, and he's being a little facetious, but it's probably not out of the realm of possibility here. It is troubling. I've argued that RFK Jr.'s impact on Canadians in particular is mostly cultural and less policy. The rationalization, the normalization of these radical views is concerning, and we're seeing that vocalization spreading a bit more up north as well. People pushing back against the utility of vaccination. We're seeing clusters of vaccine-preventable diseases cropping up increasingly so, and this can be traced directly to some of the verbiage that RFK Jr. and his compatriots espouse online and publicly. Yeah, it is truly worrying. The bright side of this is that, one, RFK Jr. is advocating for nutrition and lifestyle considerations for the prevention of disease, and that's great. I think public health has lost its eye a little bit on prevention more so than treatment. That's fantastic. And the other part of it, too, is maybe it's an opportunity for us as Canadians to divest ourselves from American leadership. when it comes to our talking points in public health. Maybe it's time for us not to wait for American data before making decisions on licensing of vaccines. Maybe it's time for us to be investing in our own live vaccine manufacturing and distribution processes, something we've been unfairly, I think, relying upon foreigners to take the lion's share of. So it's an opportunity here as well. But yes, the impact of RFK's rise is cultural and vocal, and it's going to lead to some troubling events here north of the border, no question. I really worry about if there is a genuine new public health crisis, like a human H5N1 pandemic, what will that mean for the American response and therefore the Canadian response?
Well, what do you think? I mean, that it's a possibility.
Yeah, it's a possibility. So that kind of pandemic requires the rapid mobilization of existing vaccination stocks, the manufacturing of new vaccination stocks, and the rapid licensing of new vaccines. And given his anti-vaccine zealotry, that will be slowed down at the American side. And historically, that means we slow down as well. But we don't need to. We should not be taking our leadership on this role from what happens south of the border. There's an opportunity here for Canadians to be independent of that machinery.
I mean, be independent of the machinery, but not necessarily of the misinformation.
Right.
And as we know, just when it comes to the environment, when it comes to so much, there's no respect for borders, right? I mean, these things can spread across borders.
Yeah.
So do you sound like you do, you have serious concerns about someone like this being put in a position like that?
I do. It's not affecting Canadians as much as it's affecting Americans. His messaging is tailored to the American circumstance, obviously. But there are individuals here that parrot his viewpoints. What we have to do is respond rationally, calmly, and with evidence to those claims and win the information battle from a position of truth and respectability, right? We can't be shouting at each other all the time. So yes, I'm quite concerned about this. I've said that misinformation is the crisis of our time. Nothing happens unless we get a handle on what is true, and until the population understands how to distinguish falsehood from truths, and something that we have to work at a societal level on. This is not just the job of government, of scientists, of educators. This is everyone's job now to combat misinformation.
Well, thank you for spending 5 minutes or so trying to do that with us right now. Raywat, thank you. Raywat Deonandan.
My pleasure.